All right, we'll go ahead and get started. Welcome to the California Health Interview Survey, CHIS, Data User Training Webinar. My name is Peggy Toy, and I'm the Director of Health Data. It's a public service program of the UCLA Center for Health Policy Research, and I'll be one of your trainers today. On behalf of the center, I want to thank the California Endowment for its support of CHIS and today's training webinar. So our focus today will be on the free online tools you can use to access CHIS data. These include Ask CHIS, which is a data query system to obtain statistics on a range of health topics. Ask CHIS Neighborhood Edition, a GIS tool for CHIS data by geography. And the COVID-19 dashboards. These are tools to track COVID-19 and related risk factors. Today's training provides a basic overview of each CHIS data tool and how to use them to get data that you may be interested in, how to read the estimates, and how to interpret the data. Today's webinar will feature the latest CHIS data available, including data on COVID impact, mental health, and other health topics that were added in 2020. The California Health Interview Survey is the nation's largest state health survey, the most comprehensive source of health information on Californians, with a comprehensive range of health topics available. And you'll see some of those displayed here. More than 20,000 Californians, including adults, teenagers with parent permission, and children by parent proxy, are interviewed each year on a wide range of health topics. CHIS, or the California Health Interview Survey, is conducted in multiple languages, including English, Spanish, Chinese, both Cantonese and Mandarin dialects, Korean, Vietnamese, and Tagalog. In addition to myself, we have Jacob Rosales, the CHIS Data Dissemination Manager, who will be presenting and demonstrating Neighborhood Edition and the COVID dashboards. And we have our community profile data team, Joanna Wang and Sanjana Dixit of the UCLA Center for Community Learning. So I'm going to start with Ask CHIS. I'm going to go to the California I'm going to start with the center's website because it gives you a lot of information. A lot of our researchers at the center incorporate CHIS data in their studies and have reported on their findings in addition to a wide range of other data sources. And so you may want to pursue and look at some of our publications. But on each page of the center's website, you'll see access for the California Health Interview Survey, Ask CHIS, and in health profiles where you'll find the COVID-19 dashboards. You can certainly Google Ask CHIS or the California Health Interview Survey, but we want to show you some of the great resources available online. Here is the CHIS landing page. You can get a wide range of information about CHIS, including the survey design and methods, a questionnaire for each year the survey was conducted, as well as Ask CHIS, and we'll go there.
Hi, Peggy. I'm sorry to interrupt you, but it looks like your screen sharing isn't working.
Oh, sorry. Thank you.
Thanks.
Here we are. Thank you. I was talking about the center, and then here is where you find the tabs for accessing CHIS. So this is the landing page. I was just talking about that, where you can read more about CHIS itself, the design and methods used, as well as questionnaires for each year. We'll go to Ask CHIS, publications using CHIS data, as well as an online tutorial that includes videos and technical information fact sheets on how to understand and interpret the data. With that, those links to those will be in the chat box during this webinar, so watch out for that. So now I'm going to go to Ask CHIS. And as you can see, we have the landing page for Ask CHIS. And you'll see both Ask CHIS and Neighborhood Edition. And I'm going to start with AskGIS. And as you can see, my account is already set up, but you're asked to create an account if you don't already have one. And that will enable you not only to access the tool, but also some of the features, including a library. So if you create a query, you will be able to go back to any tables or charts that you produced at your last session. All right. So when we are on the AskGIS landing page, you can see that there are 4 key variables that construct the query to produce an estimate. One is that is required is, of course, the geographic area. It defaults to the state of California, the topic that's required, as well as the number of years. When you select the topic, years will self-populate. But this feature will also enable you to strengthen estimates by using a selection of years. And then compare tops limit population, your population for your estimate. So with this, I'm going to show you the topics that we have. Now you can search if you have a specific topic in mind. And as you can see here, there are a number of questions that's been asked. Ever diagnosed with heart disease? The most recent year available will show in the listing. For this one, it shows taking medicine, but you see 2020 for several of the questions. But I like to look at the list of categories because it may present some categories that I hadn't thought of that I might be interested in. And as you can see here, there's about 19 categories with several subcategories under each one of these main categories. And so some of these questions have been asked for every year since 2001 in CHIS, and that would enable you to do trending or other broader search for data and data information. We have COVID-19, which is our latest, and I'll come back to that. Some of the other areas that have been topics that have been expanded, oral health, and we can see some of the topics in relation to oral health, and also mental health and emotional health, big topic during COVID. These were added in 2020, so you'll see some of these. These are the latest questions around mental health and emotional health. So I'm going to go back to COVID to select my topic. As I mentioned, it defaults to the state. I'm going to select diagnosis. And as you can see, we have 3 choices. And when you click on the topic, it gives you a little more detail regarding, one, the year this data is available, from which this data is available, the age group that was included in response to this question, and then how it's displayed, yes or no. And when you click on more, it gives you the actual question so that you can see for this question, have you ever had or thought you had the coronavirus, COVID-19? So now we're going to select, and as you can see, 2020 automatically appears in our years variable. So this is a very simple estimate. It may be too limited for what you're interested in, but it just simply shows you how the data is displayed. So this is a question asked of Californians. Have you ever had or thought you had COVID-19? About 10.9%. And if you hover over the estimate, it tells you how to read this. 10.9% of the population answered yes under this topic. And as you can see here, this percentage translates into an estimate of the total number of Californians who would have answered this question that they thought or had COVID. Now, one thing we might want to do is take a look at another geographic area. And I'm going to select another area here. So again, as I mentioned, you have the geographic areas organized by region. And so you'll see counties organized and clustered within regions. For some counties like Los Angeles County and San Diego, you have health planning areas, and those are displayed, and you could use those. But I'm going to select a region other than the state of California. We have the Bay Area, and I'm going to select that as my region. And so let's get data on how the Bay Area region answered this question. And as you can see, they track very closely to the state of California. And we can make a comparison by selecting our Compare Geography tab, Compare to State. And again, we can see that the Bay Area, very similar rate of those responding that they had or ever had, or thought that they had COVID. Now we're going to go back to just showing our Bay Area. Some of the other things that might be more useful, you may want to take a look at how does this break down by race and ethnicity. So we would select Compare Topics. So I'm going to select Compare Topics. And again, we go back to our topic category list. I'm going to select Demographic. And as you can see under demographic, there's a wide range of demographic categories that are available. Not just race, ethnicity, age and gender, language, marital status, education, income, residency, and so on. I'm going to select race, ethnicity. And as you can see, we have several choices here. The Office of Management and Budget, California Department of Finance. This is a category of race and ethnicity that is Latino, and then every other population as that category non-Latino. You also have census, and you can see what the categories are. The census is limited in that you don't see the Latino category. For California, that's significant. And this is the center categorization, and you can see that this category, and I'm going to select this. So this is a variable that takes into account who the respondent, which racial or ethnic category the respondent most identifies with. And I think this can be a helpful category or source for race ethnic data for a population of interest. But I'm going to go to OMB because it's most commonly used by most agencies. Now, this produces unstable estimates. And what this tells us is that it's unstable because, and it's shown as an asterisk. You will see that in a second. And what this tells us is that that population that's displayed with the asterisk may not be as representative of the true value of the population or within this particular pool for this question. And it gives us some solution. You can pool years, which for COVID, having only 1 year, that's not a solution for us, but we can we can collapse topics, and we'll see that in a second. One thing about the AskCHIS, at each point, there's a way to understand the data and to get more information. And in this instance, when you click on here in this pop-up menu, you can see it takes you directly to the frequently asked questions with more detail on the confidence interval and how to use it. I'm going to go back. All right. So as you can see, we have blank spots and we have unstable estimates in a couple of categories here. So one solution was to collapse our topic, and we want to collapse our compare topic, which is our race ethnic categories. And we will bring together those populations where we found asterisks. So as we can see, we have 5 levels here. Let's see what we have, what our results are. We still have unstable estimates, but we've stabilized some of these estimates. And as you can see here, for this population, for Black or African American, we have still remaining unstable estimates, but for all others. And we can see pretty much across the board is pretty similar in terms of those who report that they thought they had or did have COVID. So one of the things that we could do is we could certainly go back to the state. And often when you find unstable estimates, it's helpful to go back to a larger geographic size. But let's stay within our Bay Area region to see if we can make adjustments. So one thing that I'm going to do here is transpose the topic. We still have unstable estimates, but it gives us a different picture for the responses of each ethnic group. It changes the denominator. So for instance, we can look at Latino, we can see that the estimate of those who said they ever thought, of Latinos who answered this question, 25%, a fourth said that they thought or did have COVID. And again, you can see for each category of population, we've stabilized the estimate except for African American and Black. So one of the things that we could do is pool the years, but given that this is only 2020, we need to go to a larger geographic area. So with this, we're going to return to the state. And as you can see, we've stabilized for all populations. So when you come into and find an estimate where the asterisk is persistent, go up to the next geographic area in California, and that pulls in all populations for that particular population where the asterisk it persists, where the unstable estimate persists. Now, one of the things I want to show you is how we might want to pool years. So what we're going to do is we're going to change our topic. We're going to eliminate our care by topic. And we're going to change our topic. So we've displayed this in previous webinars, but I think it's a useful exercise to look at some of the tools that are available in AskCHIS. So usual sorts of care, this is one variable or one topic that has been asked in every year of AskCHIS. And it's an insight into whether or not a person is able to get health information, not only to get care, but also advisories and other resources that may be helpful to protect their health. And I'm going to select this category. Again, you can see it's selected for all years. And this variable is remained pretty much the same. So the first year that's been asked gives us a good explanation, and it's been consistent throughout. And that is that it's a construction of all of the surveys, the adult, child, and adolescent survey. And the response to this is that if they said that they go to see their doctor or identify some health care provider, that indicates that respondent has a usual source of care. We're going to select that. We're going to take a look at how that compares across race, ethnicity. We're going to select demographic in our topic categories, race, ethnicity. We're going to select Office of Management and Budget. And let's take a look at our data. Now we know we're going to produce some unstable estimates, but I want to show you a different way of approaching it. And as we can see, has a usual source of care. We have some unstable estimates. So one of the things, first I want to adjust the layout and transpose the topic. Again, this gives us a different insight in terms of the response to this question. So of Latinos responded to this question, we can see a higher percentage, 50%, a little over 50% in California report they do not have a usual source of care. And we can see that with our different populations. We still have our unstable estimate. And I do want to say that for these populations where a unstable estimate persists, you can go and take a look specifically at those populations by selecting the demographic tab. All right, so with this, and we're still in the state, let's take a look at what pooling the years does for us. So increasing the sample size in the answer to that question helps to stabilize the estimate. So we only have 2020. So let's select the most recent 5 years. Now it defaults to compare. We don't want to compare years. We want to pool years. So I'm going to select pool. And let's take a look at our estimate. All right. So we can see that we've stabilized estimates for every population. Now this defaults for the state. If we select the region, local region, we may find, like the Bay Area region or any other region, we may find that collapsing some of our groups can help to stabilize estimates for that group. And again, as we can see that by pooling the year, we can see an uptick on some of the data. So for the Latino population, it's 53, nearly 54% say that they do not have a usual source of care. We have a clear picture of what percentage of the population does not have a usual source of care, how they answer that question. So that demonstrates some of the key tools to use as you are looking at AskCHIS. And again, in the chat box, you will find that there is links to not only the websites we've shown, but also the tutorial center so that you can, again, follow along and review some of the videos and the technical information. You can export this data into an Excel spreadsheet to do further analysis. Or you can save to your library. So with that, I'm going to turn it over to Jacob, who is going to lead us through the neighborhood edition and the COVID dashboards. Jacob?
Thank you, Peggy. Hello, everyone. My name is Jacob Rosales. I am the CHIS Data Dissemination Manager, and I'm going to walk you all through using AskCHIS Neighborhood Edition and the 2021 COVID-19 Preliminary Monthly Estimates Dashboard. So let me get my screen shared. All right, just wanted to, oh, and also I've got dual monitors, so I'm staring at the big command center monitor, so you're gonna see my head kind of tilted to the side. Anyway, so the CHIS landing page is usually, the center landing page is usually one of the best spots to access AskCHIS Neighborhood Edition, or just a simple Google search of AskCHIS Neighborhood Edition can also get you there. So as Peggy had mentioned, we have this green header here, and it's on every page of the center's website. It has kind of California Health Interview Survey, AskCHIS, and health profiles. So if we click on AskCHIS, again, it'll take you to either AskCHIS or AskCHIS NE. Click on AskCHIS NE, and then you get into the page. I already logged in. So this is the main landing page for AskCHIS NE. And we have a little bit of about section kind of describing things. The setup is much different from AskCHIS with regards to running your queries and whatnot. I think one thing that's really important that I want to state is that the estimates that you get on AskCHIS Neighborhood Edition are modeled. These are modeled using small area estimation, whereas AskCHIS utilizes direct estimates from the survey data. So there's a little bit of definitely a difference in the estimates that you get. One thing about AskCHIS Neighborhood Edition is we provide these small area estimates at much smaller geographies. AskCHIS is just the state, the counties, and also some of the service planning areas or health service planning areas in Los Angeles County, or the health districts that they have in San Diego County. Whereas AskCHIS Neighborhood Edition, we have the city legislative districts, those being congressional districts, state assembly districts, state senate districts, zip codes, and also census tracts. So we have we provide a much smaller geographic area with the estimates, and that's why we're utilizing small area estimates. Another thing is with this, is you see the health topics or the health indicators that we have here. It's not as robust as AskCHIS because the small area estimation takes it's a long process to do. So we only we provide these health indicators that like health status, food insecurity, asthma, tobacco, oral health, etc. But then we also have environmental factors that are pulled from the Cal EnviroScreen data, sociodemographics that are pulled from the census, the American Community Survey. We pull that data. And then we also have these vulnerability indices that we have from, I believe, 2018 and 2016. We have an area deprivation index, healthy places index, and social vulnerability index. And also this pre-existing health vulnerability index was something that was put together by the UCLA Center for Neighborhood Knowledge, utilizing some of our small area estimates that we have in AskCHIS Neighborhood Edition. So I just wanted to throw that out there with regards to a quick little explanation of differences between AskCHIS Neighborhood Edition and AskCHIS. Also, you notice on this landing page that we have a help section. If you click on here, quick little kind of quick and dirty how to, it kind of help you navigate general information, providing you kind of more information on kind of like release notes, information on the different indicators, data limitations and use, a methodology brief kind of explaining how we leverage small area estimates, information on GIS, the geographies used, and then also an FAQ. So I highly recommend, if you're confused on anything, to come to this help section. A lot of questions that you may have can be answered here. So now we want to run a query. And so the first thing that we do is you have to select kind of like your indicator or your socio-demographic or whatever it is that you're interested in. For the purposes of this demonstration, I'm just going to pull up health status from 2018 for adults 18 to 64. And you see as that loads, what it does in my data table is it gives me the estimate for the state of California in 2018. And I'm also going to throw in poverty here as well for adults 18 and older. With regards to the different indicators, sociodemographics, environmental factors, or vulnerability indices, you can put as many as you want in the table. For this demonstration, I'm just going to leave it as for fair or poor health or living in poverty, just so the table doesn't get too big, because I want you to be able to kind of see how the map is working. So now I've got these indicators selected. Next thing I want to do is select my locations, my geographies. So here I'm going to select on this locations button. And we have a search tool for, if you want to search for counties, for cities, zip codes, this is the go-to. You'll see here census tracts. This is where you want to go to for census tracts, because they're much smaller geography and it's all using these FIPS numbers. So it's a little confusing. So we have a map on there, and I'll go over that in a few minutes. But here I'm just going to look up Los Angeles. You see I have Los Angeles County and the city of Los Angeles. And now I'm going to throw in some zip codes that I'm interested in looking at. One is a zip code in Venice, California, 90291. I'm going to throw that in there as well. And the next one is in Boyle Heights, and it's 90033. And you notice here, I have to get it into my mapping selection, I have to select this I call it the pill. I have to select the pill, and then you see how it's down there. Now you see here, it says, I have reached a maximum of 5 geographic entities to compare. In AskCHIS Neighborhood Edition, we limit you to 5 geographies that you can kind of compare. So now let's create our table and also generate our map. And you see on our table here, we have the different estimates for fair or poor health or living in poverty. And I have it by my state, my county, by my city, Los Angeles, and then my 2 zip codes. 9033 is my Boyle Heights zip code, and 90291 is my Venice, California zip code. You'll see here that the map is displaying the percent of adults living in poverty, that being less than 100% federal poverty level. The map is presented as choropleth, and as you start kind of hovering around, you get a chance to see the differences in the different zip codes. My zip code that I had targeted here, 9033 in Boyle Heights, is highlighted with an orange border to show you the zip code of interest. You can zoom in and out using your scroll bar, or using the navigation buttons. Selecting the state of California here will zoom out to the entire state of California, and you'll get to see all zip codes in California. But let's zoom back in. And then also, if you scroll down a little bit further, we have a histogram here, kind of allowing you to see where it flags where your geography of choice is. That's 9033, where it is on the histogram. You can slide this to the right, and it will start filtering out those that are, right now it's at 10%. So anything below 10%, it filters out on the map. And you can do the same with the high point. So you can start filtering them out, filtering them out, filtering them out. And also, as you're on the map here, you can toggle between the different geographies that we have. So you can toggle between the counties. Usually for the county view, it's best to have it as the entire state because counties are much larger, and it's not as useful to have it zoomed in so far. And you can do it for your congressional districts, state assembly districts, state senate districts, zip codes, cities, and tracts. If you want to export or download, you have multiple options here. If you select on export, you can export your table. It's going to send it to you as a comma-separated file. Or you can do a map, which essentially you can export your map as a .png image. So it'll export the map. It'll also include the data table. And I believe it will also include this bar chart here that shows the differences between the geographies that you selected. So now one thing I'm going to talk about now is selecting census tracts. So kind of went through just kind of like your normal run-of-the-mill geographies of counties, cities, and zip codes. But maybe you want to look a little bit deeper. Maybe, you know, because census tracts are, I mean, zip codes are, they tend to cover a larger area than census tracts. And census tracts can be utilized to kind of look at smaller neighborhoods. So let's look at some census tracts in both Venice, California, and Boyle Heights. So what I'll do is I'll select on location again. And what I'm going to do is I'm going to remove these two zip codes, and I'm going to go over to select census tracts. Now, please note that we only have census tract data available for 2018 and 2016 data. So if you are looking at, say, a 2012 data point only or a 2014 data point only, this is going to be shadowed out, and you're going to be unable to click on it because we do not have any census tract data available in 2012 or 2014. As I click on here, I get a map that generates, and I could select my census tract just based off this map if I wanted to. But again, sometimes you may not really know what area or what neighborhood. So we have this search for census tract by an address lookup. So I'll look up this address in Venice Beach and select that census tract real quick. It finds that, it puts a pin on that specific location of the address, and it also highlights your census tract. So now I'll select add selected tracts individually. It'll get added down there. And now I'm going to find a census tract at Boyle Heights. And it's found that. Put the pin on there and by the address. And now I can add my selected census tract. And now I'll go and create my table. Now we see that we have our Boyle Heights census tract highlighted, and it's highlighted in a gold border. And now you can compare that tract to other tracts in the area. You can zoom out to get a bigger view of the entire area and see where are the tracts with high levels of poverty for adults and whatnot. You can also switch to different areas. So if I want to go to my Venice Beach tract, if I go to the cell here, it's going to take me over to my Venice Beach tract. And then also if I want to switch, like right now it's showing those living in poverty, but maybe I want to look at fair or poor health for adults. If I select that cell, it will load Venice Beach for fair or poor health for adults. Likewise, I can go back to Boyle Heights for fair or poor health and see that. And then if I want to go to cities, et cetera, et cetera. Now, one thing is sometimes maybe the neighborhood that you're looking at, maybe it's a little bit larger than a tract. Maybe it's smaller than a zip code, but larger than a tract. We do provide the opportunity for users to group their tracts together. So what we'll do is we'll go back into location, and I'm just going to right now, I'm just going to focus on my Boyle Heights area. I'm no longer going to look at Venice Beach. I'm going to go back to census tract selection. I'll put in my Boyle Heights address that I have. Found that tract. Now what I can do here is I can actually combine these tracts. You have multiple options to combine tracts. If you want to, we have a lasso tool that you can utilize to just select a bunch of different tracts, or you can individually go select tracts by just clicking. And if I click again on that, it will remove my selection of that tract. This is too big of an area, so what I'm gonna do is I'm going to remove some of these tracks here. And I'm just going to stick with these 4. And now what I can do is I can select combine selected tracts. And now it's combined those tracts together, and it refers to this as census tract group 1. Now I can create my table, and you see that now it's showing a custom polygon of the combined tracts that I selected. On the data table, it shows the estimates for those tracts that are combined now. Now you can also combine counties, you can combine cities, you can combine zip codes. I'll show that real quick. I'm going to remove my census tract group, and I will combine Los Angeles County with Orange County. Please note that you can only combine, so counties can only be combined with counties. Census tracts can only be combined with census tracts. Zip codes can only be combined with zip codes, and et cetera, et cetera. They have to be the same type of geography for combination. We do not have the ability to combine, say, a census tract with a zip code or a zip code with a city. So here I've selected the counties to combine, Los Angeles County and Orange County. I'm going to add this to my current selection. And now when I create my table, you'll see that now you'll have a new custom polygon made that combines both Los Angeles with Orange counties. One other area that I wanted to also show you all is the ability to look up your assembly district, your congressional districts, or your legislative districts. We have a lookup tool. So I'm going to plug in my address at Boyle Heights. And based off that, it goes through a query and it selects my different districts that I'm looking at. So now I can add my assembly district, my state senate district, and my congressional district. And then you also have more information on who exactly the representative is for each one of those. Create your table, and now you have your congressional district here, your state Senate district, and your state assembly district. So that's the nuts and bolts of using Ask Chiz Neighborhood Edition. There's a lot of good tools here. We have, we've updated it with census tracts starting in 2016, and we'll continue to support census tract lookups in Ask Chiz Neighborhood Edition. I feel like this is a great tool for any multiple types of users, whether they're academics, researchers, policymakers, advocates, etc. Lots of great use here, and we hope that this helps you with using it. We do have online tutorials that are on YouTube that you can use, and you can also reach out to us with any other questions that maybe our tutorials or the help section doesn't provide answers to. Now I'm going to move over and switch over to talking about our COVID-19 preliminary estimates dashboard for 2021. So again, to find the preliminary estimates dashboard, you have to on our center website, you go on health profiles, click on the COVID-19 dashboards. And we have a myriad of different dashboards that you can select from. I'm going to focus on our 2021 COVID-19 preliminary monthly estimates dashboard, but also note that we do have a 2020 COVID-19 preliminary estimates dashboard. However, the one thing with this one, I would recommend going to Ask Chiz as opposed to using this one. And the reason why is the weighting for these are a little different from Ask Chiz. So you're going to see a little bit of discordance, as well as Ask Chiz allows you to cut and dice up the data at your discretion, whereas these are essentially, there's no ability to do kind of like on the fly compare by a myriad of demographics or health insurance, etc. So I personally feel that if you're interested in this, I would recommend looking at Ask Chiz for our 2020 COVID data. It's going to have more power, and you're going to have a more ability to customize it to your liking. But now let's discuss the 2021 Chiz COVID-19 preliminary monthly estimates dashboard. Please note there is no need to log in for this. If you don't have a Chiz account or you don't have an Ask Chiz account, you can access this. This is available publicly, so there's no need to log in. You just click straight on this link and it'll take you here to this dashboard. We have different subject areas. We have a COVID-19 treatment tab, a risk reduction behaviors tab, personal impacts of the pandemic tab, reasons for not having health insurance tab, and a methodology tab. On our treatments tab, you'll see that you have the ability to filter by different months. The months that we have estimates for are combined March and April, May, June, July, and August. By your COVID-19 treatment topic, those topics being ever had or thought had COVID-19, contacted health professional about COVID-19 concerns, ever tested for COVID-19, ever received a positive test result for COVID-19, and would get COVID-19 vaccine when available. And then you can filter by health indicators or sociodemographics, those being state total, age, sex, race, ethnicity, California region, educational attainment, citizenship status, household size, family type, insurance status, federal poverty level, a risk factor, which is a aggregate of asthma, diabetes, or high blood pressure, or asthma, diabetes, and high blood pressure as a standalone. The default on everything is set to a state total, as well as set to the month being August. So here you see in the state of California in August, 22.6% of adults reported that they had or thought had COVID-19. Now we could look at this by race, ethnicity, and it will filter your chart. And you get the results by race, ethnicity. You can note here that some will have a single asterisk, which just indicates that it's an unstable estimate, whereas others will have a double asterisk, which indicates that it's suppressed due to small sample size. And again, you have the ability to filter by these different health indicators and sociodemographics. Now, if we go over to the risk reduction behaviors section, we see here that we have results for how often one wore a face covering when they left home in the past week, how often they sanitized or washed hands when they left home in the past week, how often they maintained a 6 feet distance from others when left home in the past week, whether or not they gathered with persons not living in household in the past 30 days, and how often they followed state and local guidelines when gathering with persons not living in households in the past 30 days. Again, you can filter. We have some other options here. So we have a COVID-19 vaccine acceptance. So if we filter by that, we can see that those who always wore face covering when they left home in the past week, 73% always wore a face covering for those persons that had not received a COVID-19 vaccine, but would get it. Whereas 49.6% reported they always wore a face covering that would not receive a COVID-19 vaccine. Now let's move on to the personal impacts of the pandemic. And here we have a different area. We were asked about impacts due to the COVID-19 pandemic. Were they working from home? Did they continue to work as an essential worker? If they had reduced job hours or income, difficulties paying for basic necessities, they lost a job, difficulties paying for rent or mortgage, treated unfairly due to their race, ethnicity, increased mental health challenges, and childcare difficulties. You see here we get the statewide estimates for each one for the month of August. You can look at race and ethnicity. And another thing is you can filter by your type of impact, because you notice here, this is very long and maybe you don't want to drag and drop, maybe you don't want to drag it, but you can kind of see one thing that I find very interesting is looking at this treated unfairly due to race, ethnicity. And we do see that we have a little bit of instability and some suppressed estimates. And you can do this by age, et cetera, et cetera. And then also our methodology section just gives a brief explanation of the methodology that we used for developing these estimates, as well as a brief kind of explainer on CHIS. We have more details on our CHIS methodology, a link here, and then also information on the sample size from each month. So that is our 2021 California Health Interview COVID-19 estimates display here. And now I'm going to turn it over to Joanna and Sanjana. So I'm going to stop sharing my screen.
Awesome. Thanks, Jacob. Hi, everyone. I'm Joanna, and I am a current student at UCLA, and we're volunteering at the data center as part of our course called Engaging LA, where we're looking at social policies and social issues within the Los Angeles County. And so for our project, as we know, the COVID-19 pandemic impacted everyone around the world for the past year, and many medical research and policies are made because of it. Data plays a critical and valuable role in all these processes. And since the pandemic was first discovered in Asia, the Asian population is one of the most impacted groups among all impacted racial communities during the pandemic. But looking at literatures and data sets, we lack both the aggregated and disaggregated data on their behalf. Therefore, our research focus for this topic is how do the inequalities in public health affect Asian populations? And more specifically, how are the subgroups within the Asian community affected by these healthcare inequalities during COVID-19? So we'll be looking at AskCHIS, COVID-19 dashboard, and neighborhood edition to break down the question. And let me go ahead and share my screen. Awesome. first of all, we'll go to Ask Chis to kind of to look at the general health conditions for our Asian community. So to do that, we'll click Los Angeles County. And then for the topic, we'll just be looking at their health status and general health. So for the health status question, our respondents were asked the question, in general, how would you say your health is? Would you say your health is excellent, very good, good, fair, or poor? And for our comparing topic, we'll be looking at our racial groups. So demographic, race/ethnicity, and then just race. Yeah, so as we gather our data, we'll see that this statistically unstable message pop up. And as Peggy mentioned before in her presentation, this just means that we don't necessarily have enough data for more sample size to have some stable estimates. So to kind of collapse our topics, I will try to make our data have some more significant findings and stable estimates. So I'm collapsing our topics: excellent, very good, and good health conditions, and fair and poor health status. And now we can see comparing our different races along with their health status. And if we look at the Asian population in particular, 12.6% report that they have fair or poor health status. And we see from the chart that Asian is among the Latino and Black racial communities whose percentages are similar in terms of having a fair or poor health condition, whereas the white population at only 7.9% remains low in the percentage. And this reviews that Asians may be one of the communities that are also experiencing health crisis, but is often overlooked by many as they conduct healthcare research and make policies. So next up, I want to look at delayed healthcare and their access to healthcare resources. So we'll go to topic and access and utilization and delay of care. And then the question whether they got delayed care or just didn't get any other medical care. And comparing the same topic. Again, we get this warning message. But again, looking at the graphs, we can see that Asians are very close with the white in terms of their percentage. And nearly 16% of the Asian population reported that they didn't get care or got delayed care. So now let's look at some reasons that may lie behind this data point. And to do that, we can go back to topic under access and utilization, delay of care. And if we scroll down, we can see that there's a category, main reason delayed or had foregone needed medical care. And we have 4 categories with COVID-19 as one of them. And again, we're conducting the data table here. So here we have 4 main reasons listed: cost, lack of insurance or other insurance related reasons, healthcare system / provider issues and barriers, personal and other reasons, as well as COVID-19. And looking at the chart, we see that almost a third of Asians report some sort of insurance related issues that's as a reason for their delayed care, whereas 26.9% report there's some sort of barriers in the healthcare system. And this is actually one of the highest data points throughout all racial groups. And 27.4% report personal and other issues, whereas 16.7% report COVID-19 as a main issue. So as we can see from the data set, there may be something in the healthcare system or insurance reasons that's acting as a barrier for our Asian population. So there might be some other personal or other issues that are contributing to the Asians when they're trying to seek care, and they're building up the barriers for them as well. And moving on from the more physical health, I want to look at the mental health for our racial groups as well. So to do that, we can go back to topic and we can go to mental and emotional health. And here we have emotional well-being, and the respondents were asked whether they had serious psychological distress during the past year. And again, as we see across our data table here, we see that Asian is again among the racial groups who experienced some serious psychological distress here. And this could be that because of the heightened discrimination that many Asian populations faced during the COVID-19, or it could be just the risk of the unknown and some anxiety that arises because of the pandemic. But as we can see, all of our racial groups with the stable estimates were somehow impacted by 2020 in terms of their mental health, and COVID-19 may have played a big role in this. And now we want to dive into COVID-19 to look at whether the pandemic had a huge impact on our Asian population and just racial groups in general. So to do that, we can again go back to topic and go to the tab COVID-19 to take a closer look at the pandemic. And first of all, we want to look at the racism impacts to see if our respondents were treated unfairly because of race/ethnicity due to the COVID-19 pandemic. Awesome. And here we see that there is a percentage of Asians, 4.1%, who feel like they were being mistreated because of their race or ethnicity among all those who feel treated unfairly across the table. So now I'm gonna go into COVID-19 dashboard to look at in more detail what are the reasons or causes behind it. And although we have our 2021 data, I'm going to use the 2020 data because it offers a more detailed breakdown of the Asian subgroups. So we'll go into that. And here we have the tab, Asian and Native Hawaiian and Pacific Islander specific COVID-19 questions, which is a tab that's dedicated to our Asian population and has the subgroup breakdown. And we can separate our category based on ethnicity subgroups. So here we can see that there's a lot of unstable estimates. So I'm going to go ahead and jump to the stable estimates for the question if they witnessed another Asian or Pacific Islander person being treated unfairly due to their race, ethnicity, or national origin. And here we can see that about 1/3 of the Chinese population, around 1/4 of the Filipino, and around over 1/4 of the Korean population all reported that they witnessed some sort of mistreatment. So that indicates that there is definitely observations of others being treated unfairly during the period because of their race or skin color. And I also want to draw your attention to their views on government and education system during the pandemic. So the first question is whether they feel like the city or local government has done a good job managing the COVID-19 outbreak. And as we look at these data here, we see that pretty much the majority of our population feel like the local government has done a good job managing the COVID-19 outbreak. And that just means that, well, their city may be doing a good job in terms of rolling out policies that are really benefiting them in terms of healthcare access and resources. However, if we move down to whether they feel like the national government has done a good job, we see that there's a lot of red and yellow bars that indicate that they disagree with this statement, meaning that there are still a lot of needs that are unaddressed by the local government that they wish could be addressed more in terms of the national level. And to explore this topic more, I'll give it up to Sanjana to go over the neighborhood edition to explore these issues.
Hello, everybody. Thank you so much, Joanna. My name is Sanjana, and I'm a second-year molecular cell and developmental biology student at UCLA. I'm also a part of the course Engaging LA this quarter, and I'm taking an internship at the Health Data Program as a result. And today I'll be walking you through the ASTRA's Neighborhood Edition so that we're able to further see about how Asians are able to respond to public health inequalities during this pandemic. So here we're basically using Asterix, the neighborhood edition, to create kind of a community profile. And today we'll be comparing two significantly different communities to understand how each of them are able to respond. So I am going to quickly screen share. Yep. So that you're able to see my screen. So we'll be looking at two significantly different communities, one which is majorly populated by individuals who are predominantly Asian and those who are white, so that we're able to see how they respond to the various public health inequalities in the face of the pandemic and essentially its correlation with race. We'll be taking a look at several factors that would affect an individual, especially during the COVID pandemic, such as poverty, poor health, insurance, and more. So from the get-go, I'll be selecting some of these topics, starting off with socio-demographic topics. We'll be looking at an individual's education level. We'll be taking a look at their citizenship status. So we're looking at non-citizens, whether they are living in poverty. What does their work status look like? And what their race are. So since we're looking at populations which are majorly Asian, we'll be selecting that along with populations which are majorly white. All right, so these are some of the socio-demographic factors that we'll be taking a look into. So for this, the location that we're keeping in mind is Los Angeles. The area that is majorly populated by Asians, over here, we're taking a look at Monterey Park. And the area majorly populated by white individuals we're looking at is Manhattan Beach. I will now be creating a table for the same. From the get-go, you're able to notice a significant difference within Manhattan Beach as well as Monterey Park in terms of the disparities. To begin with, we can see over here that Monterey Park is 2/3 Asian only, as opposed to the 11.7% of Asians in Manhattan Beach. And similarly, Manhattan Beach is predominantly white dominated. We're having 82.2% of population of white individuals, as opposed to the 13.3% of white individuals in Monterey Park. When we're looking at individuals, for instance, living in poverty, or if we're looking at individuals who are non-citizens, we're able to see a distinct differentiation between the two, which in the long run dictates which individuals have access to healthcare and who are the most vulnerable communities, especially during this pandemic. So if we were to take a look at, say, individuals who are non-citizens, when we take a look at the map, we are able to see that this area is predominantly in the darker region, indicating that that is in the 20s, as opposed to the region of Manhattan Beach, which is towards the end. If we were to take a look at this in the map at large, just to understand where the different locations are, we see that Manhattan Beach is somewhere near the coast, as opposed to Monterey Park, which is more inland in Los Angeles. And that has to do with quite a bit in relation to what these factors kind of look like. Similarly, if we were to take a look at individuals living in poverty, we see that it's almost 4 times in Monterey Park, as opposed to 3.3% in Manhattan Beach. And so again, if we were to take a look at this within the map as well, we would be able to see that this comes in a predominantly darker range, as opposed to the individuals living in poverty. Now, at the same time, we could also add in some of the health factors. So some of the health factors that we're going to be looking into are health status, as in individuals with poor or fair health, and individuals' insurance. These are also significant factors which affect which individuals have access to resources and healthcare at any given point of time. Again, from the get-go, we're able to notice large disparities between those in Monterey Park versus Manhattan Beach. For instance, the individuals with fair or poor health is 24.3% in Monterey Park, as opposed to the 14.2% in Manhattan Beach, whereas those who are currently uninsured is almost triple in Monterey Park as opposed to Manhattan Beach. And so if we were to take a look at the same within the map once again, we would notice that the areas of Monterey Park come in a predominantly darker region on the map as opposed to the area of Manhattan Beach. Now, one question that could arise is that, is this a purely geographical trend, so specific to only a certain location, or is this indeed a racial tendency? So one way to look at that is we look into another area which is majorly populated by Asians, that is Rowland Heights. And we add it into our table. Once again, you're able to see that there is a similar amount of disparities within the two. When you look at the number of individuals who are Asians only, again, it's approximately 2/3 at Rowland Heights, with the number of white individuals being around 23.1%. And when we're again comparing the different percentages, we're able to see that, for instance, those who are currently uninsured is about 9.5% in Rowland Heights as opposed to 3.1%, almost triple. Similarly with fair and poor health, 21.6 to 14.2. And if we were to take a look at that within the map as well, once again, we would be able to notice those trends. This is in a darker region as opposed to a place such as Manhattan Beach. If we were to take a look at this, so when we take a look at Rowland Heights, we can also see where it is located in relation to Monterey Park. So Monterey Park is located right over here, while Rowland Heights is located here, with Manhattan Beach located at the coast. Yep. Now that we've understood that this is actually a racial trend, that individuals who are more uninsured, have poorer health, live in poverty, or are non-citizens, happen to be predominantly Asian, as opposed to individuals who are white, as seen on the charts, we will also be taking a look at a specific location in a low-income community to further understand this. So what we're going to do, so here I'm just going to take Los Angeles, and I'm going to take a look at Monterey Park in specific. And we're going to be selecting the census tracts. We have a location. This is one of the neighborhoods from a low-income community. And so we're just going to wait for the map to load. I'm going to be looking at a small area around this place. And we're going to combine the selected tracks. Once we've done that, I'm just going to quickly create a table. And once again, we're able to see the trends between like Los Angeles County as well as Monterey Park. So for instance, if we were going to look at areas where most individuals are non-citizens, again, it comes to around 25.5%. This is relatively close to the percentage that we can see in Monterey Park. So even if we were going to take a look at something else, such as 8.4% in the combined census tract, it's very similar in data percentages to that of Monterey Park. So this gives us a more in-depth understanding of the access to healthcare resources that individuals have, and which are the most vulnerable communities amongst Asian as well as white individuals and communities. But yeah, thank you so much.
Thank you, Sandhana. Joanna, did you want to wrap up the community profile?
Of course. Yeah, so to kind of conclude our community profile, our findings have led us to explore some public healthcare inequalities that the Asian community is facing in California and Los Angeles. With ASCHIS, our findings suggest that Asians are experiencing poor or fair health conditions. And it's also one of the biggest percentage of respondents who indicate healthcare systems / provider issue and barriers as the main reason for delayed or had forgone needed medical care. Our data also suggests that the Asian community has had psychological distresses in the past year as well. And looking at the COVID-19 dashboard, our data suggests that Asians experienced mistreatment due to racism during the pandemic, especially in terms of witnessing other unfair treatments. And from the neighborhood edition, our data suggests that when comparing an Asian dominant community to a white dominant community, Asians lack much more public health resources. So overall, the inequalities in public health prevent Asians from accessing the resources they need in a timely fashion. And the COVID-19 may have enlarged this inequality and presented more obstacles for Asians as they face more discrimination due to their race as well. And some possible ways of addressing this issue might be collecting more data on their community, both in terms of the aggregated and disaggregated format in the future, to kind of realize their needs and concerns as well as a long-term goal.
Thank you, Joanna. Thank you, Sanjana. It gives us insight on how you might use the data to understand the population. No data is perfect, so use just data in complement with other data that you may have available to better understand the topic or the population that you are concerned about. Before we go into questions and answers, I just want to share with you. I'm going to just share my screen. You should see these. Thank you, Tiffany, for staying on top of getting these in the chat box so folks can explore our online resources and to be able to send a email to the CHIS team about any questions or technical assistance you need. And so with that, I'm going to open it to questions, and Tiffany will moderate.
Great, thank you so much, Peggy. Hi, everyone. My name is Tiffany Lopes, and I'm the Communications Director here at the Center, and I'll be going through the questions from the audience. So if you have any questions, please post them using the Q&A function in Zoom. Let's start with the first question. Can you tell us about the technology of these mapping and dashboard interfaces? Are they proprietary, for example, Microsoft BI, or open source and published?
Okay, so the maps are utilized leveraging, it's called D3JS, that's data-driven documents. It's a JavaScript library. So a lot of the control of the map is all leveraging JavaScript with some I'm trying to think. It's some JSON files for .json files, topo JSON files for the different polygons, etc. And then the background maps, those were developed using, I believe, street maps. So this isn't for Ask Chiz Neighborhood Edition. This isn't leveraging like a Power BI or a Tableau. It's all custom code.
Tiffany, while you're pulling up the next question, I want to remind everybody to please complete our evaluation survey. We're shaping up the next rounds of trainings. We really want your recommendations, so please stay and look out for that link in the chat box. All right, next question, Tiffany.
I posted a bunch of the links in the chat so people can go to those. And if you have questions, like Peggy said, you can just email us. You can email us at either healthpolicy@ucla.edu if they're general questions, or CHIS specific questions can be posted to chiz@ucla.edu. The next question is there a limit to how many geographies you can combine?
Okay, so I'm assuming that this is a Ask Chiz Neighborhood Edition specific question.
Yes.
No, there's no limit. So if you want to throw in as many census tracts as you want to, go ahead. It's unlimited. So if you wanted to, combine like county-wise, if you want to combine San Diego County, Orange County, Los Angeles County, Imperial County, Riverside County, San Bernardino County, if you wanted to make just one big, massive Southern California region in Ask Chiz Neighborhood Edition, you can do that. There's really no limit on that.
Thanks, Jacob. This question, I believe, is in regard to Sanjana's presentation using Ask Chiz NE. Is this level of detail available for Sacramento County? Could you show us by zip code? We saw a heart attack hotspot in 95814.
Yes, you can. For Sacramento County, it's got any zip code that's in Sacramento County. You can, if you know the zip code, plug it into Ask Chiz Neighborhood Edition and find the indicators that you want. You can do it by zip code. If you want to look smaller than that and look at census tracts, I'm not very familiar with Sacramento County. I would recommend using like addresses. So like the question had mentioned like a heart attack hotspot and a specific zip code. Maybe you want to look at like an area, like a specific neighborhood, type in an address for that area and get get those census tracts and kind of look at that. So yeah, you can dig deep into Sacramento County. For the purposes of our presentation, we just use, I use Los Angeles County because that's the area that I'm most familiar with here in California. But yeah, if you're looking at, you know, Sacramento County, the Bay Area, down in San Diego, the same thing. The zip codes that you have in that area, plug it in. It supports all the zip codes in California. It supports all the census tracts in California.
Thanks. There's just a quick follow-up to that question as well. Is there detailed information on heart attacks in Ask Chiz?
Heart attacks, I believe we do. We have heart disease. So that would be ever diagnosed with heart disease. That's probably the closest thing that you would get with heart attacks. We don't have heart attack specific.
Are all the data points you're sharing from Chiz or from other data sources?
So in Ask Chiz Neighborhood Edition, the health topics section in here, actually, you know what I'm going to do? I am going to share my screen just to have it make more, I think this will be much more useful if I can just share my screen real quick and show you all.
And while you're doing that too, just a second piece of that question is specifically focused on the COVID questions, what the data sources for those are as well.
Okay, cool. So in Ask Chiz Neighborhood Edition here, this health topic section, these are all from the Chiz. These are all small area estimates from the Chiz. Environmental factors are from Cal and Viroscreen. The socio-demographic section is from the American Community Survey. That's a census product. So if you see here, so 2018, these are the 5-year estimates from the ACS. So this would be the 2014 to 2018 ACS 5-year estimates. This would be the 5-year estimates from 2016, from 2014, from 2012. These vulnerability indices are from the different area deprivation, I believe is from HHSA, if I'm not mistaken. Healthy Places Index is something, it's an organization out of California here. Social Vulnerability Index is, I believe, a CDC product. And this Pre-Existing Health Vulnerability Index is something that was developed through the UCLA Center for Neighborhood Knowledge, utilizing some small area estimates from 2016 Ask Chiz. What was the next section, part of your question?
So it was two. One is citizenship status, the data source for citizenship.
So citizenship status in Ask Chiz Neighborhood Edition is from the American Community Survey.
Thank you.
Now, in Ask Chiz, there is a citizenship question that we include in Ask Chiz. So in Ask Chiz, when you look at citizenship, that is a Chiz-based data point, whereas in Ask Chiz Neighborhood Edition, citizenship status is from the American Community Survey.
And then the last one was the resource for the COVID-19.
That is the COVID-19 dashboard. So the 2021 COVID-19 dashboard is from the 2021 Chiz survey. And for the 2020, both the dashboard as well as an Ask Chiz, that is from the 2020 Chiz survey.
We only have a couple questions left, so I encourage the audience, if you have questions, please get them in. So the next question is, how can I get access to the full Chiz data set?
So we have,
go ahead.
We call it the PUF, the public use data file, that's accessible for anyone. The only thing is that we don't provide information on like the county strata, so you can't, if you get that data set, it's just there's no variables that indicate kind of like the respondent's geographic location as far as county goes, etc. It's just for the entire state, but you can run estimates on that and SAS data, whatever statistical package of your liking. If you're interested in doing more kind of like refined analyses, you'd have to go through a DAC request to go through that process for that.
Thank you. And I'll post a link to some of those resources in the chat as well in a moment. One follow-up question on the data sources: is there somewhere on the website we can find the list of data sources?
Yes, on Ask Chiz Neighborhood Edition, if you go to that help area, it shows about the indicator information. Select on that, and then it'll show kind of like the different indicators that we have in there and where they're from.
Thank you. How should data from CHIS be cited?
I saw that question, and one is that you want to attribute the source as being from the California Health Interview Survey and what year. So it could be 2020 or over a 5-year period. State the percentage or the estimate and what population or what topic it's related to. So that's it in a nutshell. We do provide a diagram to construct that sentence, but those are the pieces so folks will know what the topic is, what year that data is from, and then what are your results. I hope that's helpful.
Definitely helpful. What is the cost to do an in-depth analysis with your team on variation of heart disease by zip code statewide?
That is something that they're going to want to send us an email about. I think you can send us an email about that and get kind of specific about your research question and if there's any other variables that you're looking to analyze with heart disease. Get that to us, and then we can kind of get an idea of what it's a price estimate, etc.
Thank you. I think those are all the questions that we have. If you want to, we can hold on another moment or so and see if there are any. Oh, if our data requests done through email is a question. Yes, Jacob, do you want them to email chis@ucla.edu or the DAC?
Any data requests sent to the DAC, that would be the best.
Yeah, I want to say that you can go onto the CHIS website and you can see either frequently asked questions or in the sidebar, the Data Access Center. And there are guidelines on how to apply for accessing the raw CHIS data.
And I just dropped that email address in the chat as well.
And I just want to remind everyone before you leave with, if there are no other questions, if we can close out with, please complete our evaluation. We want to make sure that the training, which is supported by the California Endowment, support your learning needs and can help you with your specific interests with data, and particularly with data from the California Health Interview Survey. Are there any other questions before we close out, Tiffany?
Looks like there's one more question for the next CHIS wave. Is there anything in particular you are considering / planning to experiment based on lessons learned from previous cycles?
I think that's a question for Jacob.
Yeah, I'm not involved extensively with the questionnaire development and the survey fielding process. So that's a hard one. I do know that for 2022, we are again going to be asking COVID-19 questions, and we're going to have some new ones beyond what we asked in 2020 as well as in 2022. But I think they're still trying to finalize those. But I haven't heard anything about kind of new anything new. I know in I believe it was the 2019 survey, we switched to more web-based. So we kind of had a redesign with regards to sample. And, it seems like we have been getting more and more adolescent respondents since that switch over. So I think that's something that we're definitely, we're happy about. And you're starting to see that more with a lot of large population-based surveys, is switching away from just kind of like the random digit dial surveys and going to like a mixed method survey. So I think that's the big one, is tapping into the online realm.
Jacob, and then I'm just going to drop one last link in the chat, the methodology, information, and survey topics. You can learn more about the questionnaire and the survey topics and the 2019-2020 methods. This link that I'm posting here.
So it can be first up. Tiffany, also re-add the link to the evaluation because we really want to hear from you about as we plan our next round of trainings. With
All
that,
set?
Okay, so thanks, a great team, and thanks everyone for joining us today. I want to give a special thanks to Ninez Ponce, who is the principal investigator for the California Health Interview Survey, and our center director, and Todd Hughes, who is the director of the California Health Interview Survey, and of course, California Endowment that makes these trainings possible and free to the public. So with that, we'll close out. And again, please complete the survey and tell us what you think, and have a wonderful day and happy holidays.